The UK is facing a mental health crisis. The numbers paint a stark picture. Urgent mental health referrals have more than doubled in the past year. The NHS, already stretched thin, is struggling to cope. Waiting lists are long, and people are waiting months for crucial treatment. This delay has devastating consequences. People are becoming more unwell while they wait. Some are even reaching crisis point. The system is overwhelmed. There are not enough beds and there are critical staff shortages. The pressure on staff is immense. They are working tirelessly, but they are being pushed to their limits. The situation is simply unsustainable. We are failing those who need help the most. The current system is not fit for purpose. We need urgent action to address this crisis before it spirals even further out of control. We need more funding, more staff, and a complete overhaul of how we approach mental health care. The UK mental health system is failing certain communities. Black individuals are far more likely to be detained under the Mental Health Act. They are also disproportionately placed on restrictive community treatment orders. This is a shocking indictment of systemic racism within mental health services. Deprived communities also face significant barriers to accessing care. People from these areas are 3 times more likely to end up in AD&D for mental health issues. This is simply unacceptable. Everyone deserves equal access to mental health care, regardless of their race or socioeconomic background. We need to address the root causes of these inequalities. We need to invest in community-based services, and we need to ensure that all mental health professionals receive training on cultural competency and unconscious bias. Only then can we start to create a fairer and more equitable mental health system. The statistics on readmission rates for young people are deeply concerning. Almost half of those detained under the Mental Health Act end up back in the system within a year. This indicates a failure to provide effective treatment and support. These young people are being let down. They are being discharged back into the same environments that contributed to their problems in the first place. This cycle of readmission is costly, both in terms of human suffering and financial resources. We need to break this cycle. We need to invest in early intervention and prevention programs. And we need to provide better support for young people transitioning out of mental health services. This includes ensuring access to housing, education, and employment opportunities. We need to give these young people the tools they need to build a brighter future. The use of out-of-area placements for mental health patients is a national scandal. Thousands of vulnerable people are being sent miles away from their homes and support networks. This is often due to a lack of available beds in their local area. Out-of-area placements can be incredibly damaging. They can lead to isolation, loneliness, and a sense of displacement. They can also make it very difficult for people to maintain contact with loved ones, which is essential for recovery. The government has pledged to reduce the use of out-of-area placements, but we need to see concrete action. We need to invest in more local mental health services, and we need to ensure that everyone has access to a bed when they need it, close to home. Anything less is simply unacceptable. Section 5. A Generation in Distress. The Youth Mental Health Crisis. The state of youth mental health in the UK is dire. 1 in 5 children now has a probable mental health disorder. This is a staggering statistic. It represents a significant increase from just a few years ago. The reasons for this crisis are complex and multifaceted. They include increasing academic pressure, social media, and the impact of the COVID-19 pandemic. Whatever the cause, the consequences are clear. We are failing our young people. Many are not getting the help they need when they need it. This is leading to a range of problems, including self-harm, substance abuse, and even suicide. We need to act now to address this crisis. We need to invest in early intervention and prevention programs, and we need to make sure that young people know where to turn for help when they need it. Beyond resilience addressing the root causes. There's been much talk about building resilience in young people. While resilience is undoubtedly important, it is not a magic bullet. it cannot be the only solution to the mental health crisis. Overemphasizing resilience can be dangerous. It can lead to the medicalization of normal emotional responses. It can also lead us to ignore the social determinants of mental health. Poverty, discrimination, and inequality all play a role in mental health. We need to address these issues if we want to see real change. We need to create a society where everyone has the opportunity to thrive. This means investing in early years support, tackling child poverty, and promoting social justice. Only then can we create a society that truly supports the mental well-being of all its citizens. Modern anxieties, climate change, and social media's toll. The world is facing unprecedented challenges. Climate change is a very real threat. The constant barrage of negative news can be overwhelming. Young people are acutely aware of these issues. Many are experiencing climate anxiety. This is a very real phenomenon. It can manifest as feelings of fear, hopelessness, and anger. Social media also plays a role in youth mental health. While social media can be a force for good, it can also have a negative impact. Cyberbullying, body image issues, and the pressure to present a perfect online persona can all take their toll. We need to teach young people how to navigate the digital world safely and responsibly. And we need to provide them with the support they need to cope with the challenges of the 21st century. Building understanding the need for mental health literacy. We need to improve mental health literacy. This means educating people about mental health. We need to teach people how to recognize the signs and symptoms of mental illness. We also need to teach people how to support others who may be struggling. This education should start at a young age. Schools should provide comprehensive mental health education. This will help to reduce stigma and promote help-seeking behavior. We also need to educate the public about mental health. This can be done through public awareness campaigns and media coverage. The more we talk about mental health, the less stigma there will be. We need to create a society where it is okay to not be okay, and we need to make sure that everyone knows how to get help when they need it. A call for change, systemic solutions, and hope for the future. The UK mental health crisis is a complex issue. There is no easy solution, but there are things we can do. We need to see a significant increase in funding for mental health services. This funding needs to be ring-fenced, and it needs to be targeted at the areas of greatest need. We also need to address the workforce crisis in mental health. We need to recruit more psychiatrists, psychologists, nurses, and social workers. And we need to retain the staff we already have. This means improving working conditions and pay. The government has announced plans to recruit more mental health staff. This is a welcome step, but it is only a first step. We need to see sustained investment in mental health services if we want to make a real difference. The time for action is now.